So you've had your cataract surgery, you're hoping to be spectacle free and you're not spectacle free. Sadly, this happens an awful lot. There are lots of reasons for this. First and foremost, nobody can promise you to be spectacle independent after your cataract surgery or your lens extraction surgery. It's just impossible. We do everything we can to minimise the chance of you requiring spectacles, but almost inevitably you will require some degree of spectacle correction to get your best possible vision. We want you as good as possible without spectacles on, and if we consider premium lens options, which is a different talk, then we try and give you distance and intermediate and maybe even reading vision as well without your spectacles on. Nothing is as perfect as when you were 18, and so there is a compromised vision, but again that is discussed in another video. Even if you have an ordinary lens in, which your consultant will discuss with you, the ordinary monofocal lens, we will do our best to try and save for distance. Now that means that we rely on calculations. It's all about the effective lens position inside the eye. If you imagine the eye sits there like that and your lens sits in there, we need to know where it's going to sit in order to work out the lens power. If it sits forward, the lens power is increased. If it sits back, it's weakened. And we don't really know where that lens sits because each eye is individual. We can make a good guess and calculation on it by doing clever calculations, and what we do is we measure the length of the eye and the curvature of the cornea, and we look at databases and calculations and clever algorithms to try and work out and say if we put X power lens into Mrs. Smith's eyes it should set her for distance. But there is some degree of variability. We aim to try and get you within about plus or minus one diopter, but up to 10% of people can be outside that, and so it's important you know there are no guarantees. I myself do multiple calculations using a special calculator where we do six formulae in order to try and work out lens power, and I use the most average one. So it's worth asking your surgeon what calculation do you use, and there's this new calculator called the ESCRS calculator, the European Society of Cataract and Refractive Surgeons calculator, which gives you input the data and it uses 6 formulae in order to give you an answer and recommendation for a lens. And it's well worth asking your surgeon, will you be using that for me? Astigmatism is also something that could preclude a good outcome visually. If you've got more than one diopter of astigmatism, it can mess up the visual outcome afterwards. Astigmatism means the cornea is rugby ball shaped, and if you press on your eye, you'll see the vision goes more blurry, and that is because you're inducing astigmatism. It's really important that the surgeon you see understands astigmatism, and it's well worth asking, do I have astigmatism and what are you going to do about it? If the astigmatism is less than 1, then often our incision and the placement of our incision can actually take away the astigmatism. If you imagine the cornea is rugby ball shaped, if we place an incision on the sort of steeper bit of the rugby ball, that loosens it off and changes the shape. So we can address that. If you've got more than one diopter of astigmatism, then it could be worth asking your surgeon about a potential toric lens. Now a toric lens is where we take away the astigmatism by mimicking the astigmatism from the front of the eye, the rugby ball shape, and putting it in a lens inside the eye and orientating that at 90 degrees. So it could be worth asking, is there anything like that you can do? If they don't have the facilities to use toric lenses, then potentially they can make incisions on the cornea to change the shape. If we aim for distance and we get you set for distance but your astigmatism stays, you will still require spectacles. Without a doubt, we're going to be better anyway, and your vision is going to be sharper because in the majority of people we take away the cataract. But sometimes you can still be reliant on spectacles, which can be disappointing for people. So it may be inaccuracies in calculations. There's not something wrong. It's the right lens that we chose for you, the right calculation, but sometimes it can be the wrong lens for you. Often we use the calculation for one eye to refine the calculation for the second eye and try and get you a little bit closer for distance. The patients who want premium lenses and trying to get distance and intermediate and near vision, again there is no guarantee, and it's really important you know that. We do our very best for you, and your surgeon will discuss it with you, discuss the pros and cons, and also what we can achieve and what we realistically cannot achieve. If we have clever multifocal lenses or bifocal lenses, we reduce light intensity down, so it's a compromised vision. Our aim is to make you happy. We don't want you to be unhappy, we want to give you the best possible vision. So it's all about realistic expectations as well. We tell you what we can achieve, what we can't achieve, and we tell you that we're going to do our very best to achieve it for you. But there is no guarantee, and sometimes you still require specs. I myself am about minus 0.75 and minus 0.1 in my eyes. That means that I can read without specs on really quite well, and I can drive without specs on really quite well. When I wear spectacles, my vision does sharpen up a little bit, but I choose not to wear them because actually I'm perfectly fine as I am. I can read without spectacles, but when I put reading specs on, it does sharpen up a little bit. And I guess if I was going to be reading for a prolonged period of time, I would want to wear reading spectacles, but I choose not to. And that is often the outcome which your surgeon will achieve for you, is not quite perfection, but good vision for you without spectacles on. But if you're expecting perfection, then that's not going to be achieved, and it's important you have an open and frank discussion with your surgeon about it. Sometimes people will still require specs for their best vision, or maybe driving vision, certainly sometimes reading vision, and if you have a monofocal lens, almost inevitably reading vision you will require spectacles for. You've got to go into this knowing what to expect, and your surgeon will explain it all to you and give you realistic expectations about what to achieve.